Every single day, your kidneys work silently, without asking for attention. Every minute, they filter your blood, remove waste, balance fluids, control minerals, help regulate blood pressure, and even play a role in producing red blood cells. They're among the hardest working organs in your body. Yet most people rarely think about them. Why? Because healthy kidneys don't usually make noise. They don't hurt. They don't complain. And that's exactly what makes kidney disease so dangerous. Unlike a broken bone or a heart attack, kidney damage often develops quietly. Over many years. No dramatic warning. No obvious symptoms. By the time many people realize something is wrong, they may have already lost a significant amount of kidney function. In fact, medical experts often call chronic kidney disease a silent disease. Millions of people are living with kidney damage without even knowing it. Some don't discover the problem until a routine blood test. Others find out only after symptoms become impossible to ignore. The frightening part is that by then, the damage may already be difficult to reverse. But why does this happen? Why can such an important organ fail without giving clear warning signs? Is it simply bad luck? Or are there hidden risk factors that millions of people overlook every day? The answer may surprise you, because in many cases, kidney disease doesn't begin inside the kidneys. It begins with conditions that seem completely unrelated. High blood pressure, diabetes, obesity, smoking, certain medications, and even long-term dehydration. These common problems can slowly damage the tiny blood vessels inside the kidneys, year after year, without causing pain. And because the kidneys have an incredible ability to compensate, they continue working, even while damage is quietly increasing. That's why many people feel perfectly healthy until their kidney function has already dropped significantly. So, what exactly do your kidneys do? Why are they so important? And what are the early warning signs that most people miss? To answer those questions, we first need to understand how these remarkable organs keep you alive every single minute of every single day. So, what exactly do your kidneys do? Despite their small size, your kidneys perform one of the most important jobs in your entire body. Every single day, they filter nearly 180 liters of blood, removing waste products, the extra water, and toxins, while keeping the nutrients your body still needs. Think of your kidneys as the world's most advanced water filtration system, but instead of cleaning dirty water, they clean your blood every minute of every day. They also help control your blood pressure, maintain healthy levels of sodium and potassium, balance your body's fluids, and produce hormones that keep your bones strong and help your body make red blood cells. Without healthy kidneys, none of these systems work properly. The problem begins when these tiny filters, called nephrons, start becoming damaged. Each kidney contains around 1 million nephrons. Together, they work continuously, filtering your blood thousands of times every day. The remarkable thing is, your kidneys have far more filtering capacity than you actually need. That means, if some nephrons become damaged, the healthy ones simply work harder. At first, this sounds like a good thing, but there's a hidden cost. The extra workload places more stress on the remaining healthy nephrons. Over time, they begin to wear out too. This creates a slow cycle of damage that can continue for years without causing any noticeable symptoms. So what causes this damage in the first place? For most people, the biggest causes are surprisingly common. The first is high blood pressure. When blood pressure stays high for years, it puts constant pressure on the tiny blood vessels inside the kidneys. Gradually, those delicate filters become scarred, making it harder for the kidneys to clean the blood efficiently. The second major cause is diabetes. When blood sugar remains too high for too long, it slowly damages the kidney's filtering system. Excess glucose injures the tiny blood vessels, causing protein to leak into the urine, one of the earliest warning signs of kidney disease. Together, diabetes and high blood pressure are responsible for the majority of chronic kidney disease cases worldwide. But they aren't the only risks. Smoking, obesity, long-term use of certain painkillers, and even a family history of kidney disease can all increase your risk. The dangerous part is that these risk factors often work silently. You may feel perfectly healthy, while your kidneys are slowly losing function, which raises an important question. If kidney disease develops so quietly, are there any warning signs before it's too late? The answer is yes, but they're often subtle and very easy to ignore. If kidney disease is often called a silent disease, how can you possibly know something is wrong? The truth is, your body does give warning signs. The problem is, they're usually subtle, easy to dismiss, and often mistaken for something else. One of the earliest signs is feeling tired all the time. Healthy kidneys help produce a hormone called erythropoietin, which tells your body to make red blood cells. As kidney function declines, your body may produce fewer red blood cells, leading to anemia. The result? Constant fatigue, weakness, and low energy. Another warning sign is swelling. Your kidneys normally remove extra salt and water from your body. When they can't do that efficiently, fluid begins to build up. You may notice swelling in your feet, ankles, legs, or even around your eyes, especially in the morning. Changes in urination can also be an important clue. Some people begin urinating more often, especially at night. Others notice foamy urine, which may indicate that protein is leaking through damaged kidney filters. Some notice blood in the urine. Others produce much less urine than usual. None of these symptoms automatically mean kidney disease, but they should never be ignored. As kidney function continues to decline, waste products begin building up in the bloodstream. This can cause nausea, loss of appetite, itchy skin, difficulty concentrating, muscle cramps, or even a metallic taste in the mouth. The challenge is, these symptoms are common in many other conditions too. That's why kidney disease cannot be diagnosed based on symptoms alone. Doctors rely on simple laboratory tests. One of the most important is a blood test called creatinine. Creatinine is a waste product produced by your muscles. Healthy kidneys remove it from your blood. When kidney function falls, creatinine levels usually begin to rise. But creatinine alone doesn't tell the whole story. Doctors also calculate something called the estimated glomerular filtration rate, or eGFR. Think of eGFR as a measure of how well your kidneys are filtering your blood. In general, an eGFR of 90 or above is considered normal for many adults, although interpretation depends on age and other factors. An eGFR below 60 that persists for 3 months or longer may indicate chronic kidney disease. Doctors also examine your urine. A simple urine test can detect protein blood or other abnormalities long before symptoms appear. That's why routine health checkups are so valuable. Many people discover kidney disease through a routine blood or urine test before they ever feel sick. And when it's found early, there is often much more that can be done to slow its progression. So, if early detection can make such a difference, what can you actually do to protect your kidneys before serious damage occurs? The answer isn't complicated, but it does require consistency. So, if kidney disease can remain hidden for years, what can you actually do to protect yourself? The encouraging news is that many of the biggest risk factors are also preventable. The first step is controlling your blood pressure. High blood pressure is one of the leading causes of kidney damage worldwide. Keeping it within a healthy range reduces the constant stress placed on the kidney's tiny blood vessels. The second is managing blood sugar. If you have diabetes or prediabetes, keeping your blood glucose under control is one of the most effective ways to protect your kidneys over the long term. A healthy diet also makes a difference. Eating more vegetables, fruits, whole grains, beans, and healthy sources of protein, while limiting highly processed foods and excess salt, can support both kidney health and overall cardiovascular health. Staying physically active is equally important. Regular exercise helps control blood pressure, improves insulin sensitivity, supports a healthy weight, and reduces the strain on your kidneys. Hydration matters too. Your kidneys need enough water to do their job properly. But despite what social media often claims, drinking excessive amounts of water doesn't clean or detox healthy kidneys. For most people, drinking enough water to stay properly hydrated is all that's needed. Another important habit is using medications wisely. Painkillers known as NSAIDs, such as ibuprofen or naproxen, can be safe when used occasionally and as directed. But frequent or long-term use, especially in people with existing kidney disease or dehydration, can increase the risk of kidney injury. That's why it's important to follow medical advice and avoid taking medications unnecessarily. If you smoke, quitting is one of the best decisions you can make. Smoking damages blood vessels throughout the body, including those that supply your kidneys. And if you have conditions like diabetes, high blood pressure, or a family history of kidney disease, don't wait for symptoms. Routine blood and urine tests can identify problems early, when treatment has the greatest chance of slowing further damage. Perhaps the biggest myth of all is believing that healthy kidneys will always let you know when something is wrong. Unfortunately, that's not how kidney disease works. Silence doesn't always mean safety. Sometimes it simply means the damage hasn't become obvious yet. The good news is that knowledge changes outcomes. Understanding your risk, checking your blood pressure, monitoring your blood sugar, living an active lifestyle, and getting regular health checkups can protect your kidneys for years to come. Your kidneys work for you every minute of every day without asking for attention. Maybe it's time we return the favor. Because protecting your kidneys doesn't begin when symptoms appear. It begins long before. That with the choices you make today, if this documentary helped you better understand your kidneys, consider sharing it with someone you care about. Because sometimes a simple conversation or a routine health check can make the difference between early prevention and lifelong disease.